Hi, today I'll be making a video on exposure and response prevention, ERP therapy, which is considered like for OCD treatment. In my opinion, I feel that ACT therapy, acceptance and commitment therapy, and exposure and response prevention therapy, both are the key to treat your OCD. So, what is ERP therapy? ERP therapy, as it is called, exposure response prevention. You expose yourself to the thoughts, like the situation which is creating anxiety in you, and then you accept the anxiety. Exposure, you expose yourself and you accept the anxiety and don't do the response. The response is your compulsion. So in OCD, what we do, like mostly what happens is that you get obsessive thoughts, and then those obsessive thoughts lead to anxiety. And to stop that anxiety, you do compulsion. You may do mental compulsion, as in you may chant some mantras, or you count some numbers, or even you argue with your thoughts. You rationalize. That is called rationalizing compulsion. So you rationalize with your thoughts. A lot of people have this compulsion and they do not understand. For example, if they have a thought that they will harm someone, so then they will start arguing with that thought. No, no, I will not harm someone. I am such a good person. So you start arguing with your own thoughts. Rationalizing compulsion, you argue with your own thoughts like a lawyer. So these type of compulsions, washing hands, those are external compulsions. So all those happen, and you are not able to control those compulsions because you've it started those compulsions started because you felt that if I do these compulsions, I will my anxiety will stop. But that anxiety doesn't stop. Because of those compulsions, the anxiety keep on increasing. So what to do? So in ERP, what we do is we, we by ourselves think of those thoughts which are creating which is creating the anxiety. So maybe if I have harm thoughts, I'll think of that. Yes, I'll harm someone. I'll harm my sister. I'll harm my mom. I'll keep on thinking those thoughts, and then I will have anxiety. Okay, and then I will accept that anxiety, face that anxiety, and I will not do my compulsion. Maybe my compulsion is to argue. So argue with my own thoughts. So my thoughts will keep on coming. That like those thoughts, that obsessive thoughts, but I will not argue with them. I'll just observe them and let them go, and I will let the anxiety build. So for example, someone who is afraid of a lift, it is like you will ask him to go inside the lift, and like even if he's feeling anxious, go in the lift and like press a button and go up or down in the lift. So but the thing is that you have to understand that if you are very anxious, you cannot just start. If you are like very anxious, you are very afraid of the lift, you cannot just go inside the lift and start like using the lift, right? You will have to do it step by step. For example, you have OCD and you are getting these thoughts for so many years. You cannot just accept those thoughts in a day. I also understand if you sit and you, for example, if you have HOCD, homosexual OCD, and you keep on thinking about these thoughts, then and these thoughts you are having it for so many years, but you sit and you start facing those thoughts. I'm sure you'll not be able to face them for more than 10 seconds. But the thing is that the trick is to start small. So for example, in the example that I gave of the lift, so a person who is afraid of the lift, maybe for the first 2 3 days he will just see a picture of the lift. He will see a picture of the lift, and he will see that the anxiety is coming. Okay, and then he will accept the anxiety and face the anxiety. So what is accepting the anxiety, that I will come to later. But first to understand what is ERP, then maybe in the second week he will like go to a lift and see the lift from outside but not go inside, right? So and he will just see the lift, he will face the anxiety, but he will not run away. That is his compulsion, right? If he sees the lift, he runs away. Then maybe in third week, he may go inside the lift, but he will not press any button. He will just stand there with the lift open. The next week, he may go inside the lift, close the door, but not go up and down. And in like the fifth week, the next week, maybe he'll go to the lift and he will press the button, and he will, so slowly he will face his fear. ERP is about facing your fear. Like the Mountain Dew ads, that डर के आगे जीत है. You have to face your fears. If you keep on running away from your fears, that fears will increase. Okay, so ERP, you understood, you have to think of your the thoughts which are giving you like terror. So one thing that people do not are not able to understand, for example, if a person is has HOCD, he feels that okay, I'm okay if I am gay. But the thing is that but then why am I afraid? I am okay, I am not homophobic, I will accept I am gay. But the thing is that you are not afraid of being gay, you are afraid of those thoughts. So you have to face those thoughts. When you started facing those, the idea of being gay is not creating anxiety, those thoughts are creating anxiety. So think of those thoughts, and when you think of those thoughts, you will the anxiety will come. Now what is anxiety? Anxiety are just body sensations. For example, when anxiety comes, I feel cold, I feel there's a lot of sweat comes, my hand feels cold, my uh, feet start to shiver, my there's a tightness in my chest. So the thing is that you have to accept those sensations, body sensations. What is anxiety? Anxiety is just body sensations, but you are feeling afraid of it. You are feeling what is happening, I'll die. But anxiety is natural. Anxiety is a part of our emotion repertoire. It is uh, so basically, if you do not feel anxiety, if you do not feel anxious, even in like dangerous situations, then for example, if a lion comes in front of you and you don't feel anxious, you will go to the lion and the lion will kill you, right? So anxiety is important. Exam anxiety is there, then only you are studying. But if there is no anxiety, you will just chill. But there should be a balance. Too much anxiety and you will forget everything and will not be able to write. So now the problem with you is that it is too much anxiety, and anxiety for things which you should not be anxious of. You should not be afraid of those things. So you should start facing your fear. So when for example, when I am saying that think of those harm thoughts, think of those harm thoughts by yourself. Sit, relax, take two breaths, and then think of those harmful thoughts, okay, by yourself. And when those body sensations come of anxiety, face them, but don't do your compulsions. Your compulsions could be anything of checking if I have I harmed someone, or maybe arguing with your thoughts. It could be anything, but don't do your compulsions. Face your anxiety. The whole thing is that of facing the anxiety. If you face your anxiety, you will see that the anxiety will die down. What you now feel is that if I don't do my compulsion, my anxiety will never go away. But you will yourself see that uh, if you stop your compulsions, okay, then also the anxiety will go. It is not that because of your compulsions anxiety is going. Because of your compulsion, the anxiety is continuing. But if you stop your compulsions for some time, maybe 5-10 minutes, you will face a lot of anxiety. But with time it will die down. It is like, for example, if you are trying to learn a cycle, uh, in the start you feel very you feel that it is too difficult, right? You're not able to do it. But with practice you are able to do it. Same thing with ERP. In the start you will feel that this is too much anxiety, I am uh, not able to face it. But with time and with small steps, like I gave you the example of the lift, with the small steps you will be able to face your anxiety. This There's this concept called SUDS, subjective unit of distress scale, in ERP. I don't want to make this video too scientific. You don't have to give an exam. You just have to understand the therapy and do it. My intention always is to make such videos that you will understand it and do it. I want to focus on the practical aspect of it. So SUDS is basically, uh, for example, if seeing the lift gives you 10, like the anxiety is 10, so it is 10 SUDS. Then maybe going to the lift, just seeing the lift in real life, that is 20 suds. So you are basically in ERP you have to keep on increasing your suds. That is, you have to step by step increase your anxiety intensity of facing it. uh, the time that you should take, like every ERP session should be around, like it is said 45 minutes, but I have done 25-30 minutes also. You can do it by yourself also. For example, if you have contamination OCD, you can see, you can uh, take your phone and rub it in some dirt or something, and you will feel the compulsion of like cleaning the phone or something, but you don't clean it. You see the phone and that anxiety will come and that thought will come, clean it, but you will not clean it, and your anxiety will die down. So ERP, this graph is like the anxiety will start like this, it will go up, 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 and with time you don't do compulsion, it will go down. And for surely it will go down, and also your thoughts thoughts frequency will also go down, and your anxiety intense thoughts frequency will go down, and also your anxiety's intensity will also go down. So yeah, this is ERP. In ERP, basically you have to face your fears, face your thoughts. What you are afraid is of is your thoughts, right? So you have to think of your thoughts, think of your obsessive thoughts by yourself. ठीक है, you have to take some time out to do ERP. Maybe like every alternate day, do for 25 minutes, or maybe like for 3 days, uh, 3 days in a week, you do 45 minutes, or maybe every day you do 15-20 minutes. I used to do it every day for 15-20 minutes, but you will have to do this ERP until the anxiety comes down, right? You cannot just leave in between. You have to do it until that thought is not giving you any anxiety, that anxiety has died out. You have to keep on thinking of that again, thought again and again, that intrusive thought again and again, again and again. So harm thought, I'll hit someone, I'll hit someone, or HOCD thoughts, any thought, just keep on thinking, the anxiety will increase. Then just sit with your anxiety. Okay, my body sensations is there. Uh, Shift your focus to those body sensations. Okay, my chest is feeling tight, I am feeling a headache, my sweat is come. Just sit with it. Awareness is very important in this. Just sit with your anxiety, but don't do your compulsion. Okay, you have to accept your anxiety. Accepting anxiety means to accept the body sensations, and I am sure you are bold enough to accept your body sensations. You were just missing this information. You have got the information, this knowledge you have got, and this knowledge will liberate you. Okay, so yeah, so I have given you everything. What is ERP? How to do it? Accepting the anxiety, the time limit, how much time you should do. In the books, it is written like 45 minute session, but it depends on you. But you should do. You should finish the ERP session only when that anxiety for with that particular thought. And every day, maybe you can take one obsessive thought, or maybe you can take two, three obsessive thoughts. But keep on repeating it to yourself, and do it till that those thoughts are not giving you any anxiety. Okay, so I hope this video is okay with you. And yeah, I am making these videos in English, so do write in the comment if you're liking these videos, if my English is okay, if I need to work on my English. So yeah, that feedback I'll take, that will help me. And also keep connected, and whatever the situation is, whatever the problem is, don't lose hope. Keep fighting.